Hi, Dr. Momo here. Today we are going to talk about normal newborn feeding habits for a breastfed kiddo. All right, you're probably thinking, how much can this tiny human eat? Well, let's break it down. Right after birth, baby's tummy is so tiny, like the size of a cherry. They'll drink just a few tablespoons of that thick, rich colostrum at first. And yes, those hungry little monsters will need to eat 8 to 12 times a day. That's the important part, 8 to 12 times a day. So in that 24-hour period, that's how many feedings you want to look for. Somewhere around day 3 to 7, you start seeing your milk transition into transitional milk. Okay, this is kind of the in-between milk. Suddenly, you'll know this has happened because suddenly it might feel like your boobs are going to explode. Again, totally normal. All right, baby's tummy has now grown to about the size of a walnut. They're getting more milk per feeding, but guess what? They're still needing to eat 8 to 12 times a day. More if they're hitting a growth spurt. Wait, a growth spurt already? Yes. By about day 7 to 10, babies go through their first growth spurt. That's really hard to say for some reason. So if it feels like 400% of your time is spent nursing your kiddo, you're right. That's all that's going to happen for those days that baby is going through a growth spurt. And more feeds equals more nutrition equals more milk production. So your body just automatically keeps up. By day 14, you and baby are normally probably in a pretty good rhythm. They're still going to be eating 8 to 12 times a day. Their tummy is now about the size of an apricot. And they're still, again, nursing that 8 to 12 times a day. That's the really important piece that you want to focus on. But they're more efficient at getting milk. Some of the feeds will be short, some will be long. That's okay. They know what they need. Win-win. Your body is better at making milk. They're better at removing milk. Okay, what do we watch for so that we know that baby is actually getting the milk that we think and hope we're producing? So frequent feedings is normal. It helps establish your milk supply. So 8 to 12, that's what you're trying to hit every day. Baby knows how much they need. So watch for hunger cues, that rooting, sucking, those kind of things. All right, focus on growth spurts. Again, that cluster feeding where it just seems like you can't get enough milk in them, that doesn't mean that anything's wrong. That means that baby is growing and learning, and you're making more milk to support that, and they're removing more milk so they can keep growing. All right, the big thing, how you know all of this is working. You want to focus on their weight and wet and poopy diapers. So check the other videos for how many diapers is normal at each stage in the game. But with weight, by day 14, we want them back at birth weight, and we want them to continue growing. All right, don't worry about where on the growth chart they are as long as they're continuing to track up for them. All right, so that's it. Keep feeding that baby on demand. Trust your body and your baby, and reach out for support if you need it. Don't wait too long. Don't be ashamed. You've got this. All right, until next time, do good, kiss the baby, love yourself. Toodles!